Well, Crohn's disease is a condition of inflammation in the bowel, and as you can imagine, it can create all sorts of symptoms. Very typically, it's something to do with diarrhea. So patients get a change in their bowel habit, and often a bloody diarrhea that they present with. But Crohn's can affect anywhere from the mouth right the way down to your bottom. And so there can be different symptoms from that. Ulcers in the mouth, you can get things called fistulas in the bottom. You can have problems with bleeding. You can have problems with weight loss because you're just not absorbing food. And that's part of the problem with Crohn's disease, that it mimics a lot of other conditions. It's sometimes very difficult to diagnose and often quite long delays to get to the right diagnosis. So very varied, but traditionally it's diarrhea, often bloody diarrhea with weight loss, abdominal pain, and a number of these other things that can go with it. So quite a varied symptomatology. So in terms of complications, there'd be the sort of general complications of the disease. So weight loss, getting anemic, so you get tired. So generally feeling unwell with the disease would be one problem. But then because the inflammation in Crohn's disease can create narrowings in the bowel, you can end up with things called strictures. And so strictures can cause problems with absorbing food. They can create problems with food going through the intestinal tract, and therefore you get obstructions, you can get vomiting, and obviously that adds to that whole burden of other symptoms. So stricturing of the disease, that's narrowing in the bowel. You can also create ulcers in the bowel, and the bowel can connect to other bits of anatomy in the abdominal cavity. So you can get fistulas from one bit of bowel to the next. That's a connection, an abnormal connection. You can get fistulas around your bottom. You can get fistulas out onto the skin. You can get fistulas into the bladder. So a variety of other really complicated problems that you can get with Crohn's disease. And so a real spectrum, right from just tiredness and a bit of anemia, right the way through to really very complex, penetrating, fistulating disease and obstructing disease. So again, very varied. So treatment for Crohn's disease, and there's a huge amount out there available for treating Crohn's disease, but I would argue the most important thing about treating Crohn's disease is you need to treat within a team. So you need to have experts in the medical management of inflammatory bowel disease or Crohn's disease, along with experts in the surgical management. We have experts in the pathology, we have experts in the radiology. So we have a multidisciplinary team. But in principle, the idea is that you treat with medicine so that you suppress the immune system, which is what's driving the inflammation, so that you don't have inflammation. So we try and switch off the Crohn's disease using a variety of really quite complicated medicines nowadays. Sometimes that works, and sometimes that's all that you need. Sometimes that's not enough, and you end up getting some of the complications we talked about, so narrowing in the bowel. You end up getting fistulas with the bowel, and that's when you need a good surgical team to come in and remove that bit of the Crohn's disease, so you can go back to trying to suppress it with medicine. So it's really a combination, and when you operate and what treatments you use and how you keep things under control is part of that multidisciplinary team. And I think we've changed Crohn's disease in the last 5-10 years, that we don't operate as much as we used to because we're getting much better at managing the medical side of things. Last thing, I think some people are very worried about the medicine. They are strong medicines, immunosuppressive medicines, and there are side effects. But you need to balance that against the side effects of the disease. And so having a really experienced team to be able to guide you as to whether or not you need this medicine, that medicine or the other, and when you need an operation, I think that's almost more important than some of the treatments themselves. So yeah, there's a variety of conditions under the broad term of inflammatory bowel disease. Crohn's disease is one of them. The other well-known one is ulcerative colitis. The big difference, and it's almost in the name, is that ulcerative colitis only affects the colon, whereas Crohn's disease can affect the gastrointestinal tract from the mouth right the way down to your bottom. And so there is, you can imagine, in a way, from ulcerative colitis, if you need to, you can remove the colon and the disease will go away. That's not true for Crohn's disease, so that you can only remove the active bits. The other thing about Crohn's disease is that the inflammation in Crohn's disease goes right the way across the wall of the bowel, and that's why you can get narrowing in the bowel, as we've talked about, and that's why you can get fistulas in the bowel, whereas in ulcerative colitis, it's only the lining of the bowel that gets involved. And so that the complications, as it were, of ulcerative colitis tend to be less of a problem. And most patients who need surgery for ulcerative colitis are the result of uncontrolled symptoms, which is terrible diarrhea and urgency. So there's a difference in the distribution of the disease with ulcerative colitis, and there's a difference in where the disease is within the bowel. But again, the treatment is multidisciplinary. The medical treatment for ulcerative colitis has got much better over the last 10, 15 years. And we operate on significantly less ulcerative colitis nowadays than Crohn's disease. So perhaps an easier disease to treat, and in effect an easier disease to operate on, because you can remove the whole colon. Obviously there are consequences to that. So they're similar in terms of managing them with a multidisciplinary team, but different in terms of those things we've just discussed.